And so actually in 2012-13, right after I graduated dental school, I joined Mercy Ships, and just by chance, it was here in Conakry, Guinea. So I did the whole field service, about 10 months working as a dentist on the dental team, seeing a lot of patients every day. I mean, I gained a lot of experience, met a lot of awesome people, but we would just continue seeing patient after patient after patient after patient after patient after patient, right? The line never stopped, just kept growing and growing and growing, right? And so you start looking at this problem, especially when you've been doing it for 10 months. There's some foundational principle that you're not hitting here, because why is that line growing? If the need is that much, why is the need that much? That experience with Mercy Ships in 2012-13 really got me interested in expanding and understanding and trying to learn more of how to affect the dental system here in Guinea. That was the start of how I got here. Why I'm here now? You wake up every day, and if this is the place you're supposed to be, you stay there. That's it. We decided to do our dental program at the dental school. So initially we just renovated the space. They allowed us to use a room for our normal Mercy Ships dental program. And then during the field service, the dean at the time asked if we could incorporate some of the students into our program so they can get some experience in clinic. And that was kind of the birth of how we really started forming a true partnership with the university and the dental department. The reason we have started focusing more on dental education here in Guinea is you notice there's a huge problem with the health workforce gap. In the US, we're used to one dentist per 2,000, 3,000, 5,000 people. You go to some African countries, you're at 1 per 1 million. And so that is the issue that you have, is you can't even really start talking about dental being functional and developed and be able to treat the population because you don't even have a health workforce to start that conversation. If you don't have dentists in country, you can't provide dental treatment, okay? You cannot have dentists in country unless you have a dental school. So that is the big focus of why we're here at the dental school. The problem was because of resource constraints in the department, they were having more problems with the clinical training experience side for the students.
Parce qu'au cours de notre formation, on n'avait pas du tout suivi des formations pratiques. C'était littéraire.
You can have 50 dentists, but if they don't have the experience in clinic, if they don't have the experience with patients, you're going to graduate a lot of dentists. You're going to have a great improvement in health workforce to population. But the problem is, functionally, it's not going to make a difference for the actual true need for the population. If anything, it puts the population even more at risk if these are not well-trained dentists, because then they might start doing procedures that they don't fully understand, or they're not fully qualified for, or they're not fully trained for.
Il y a eu une de mes tantes qui a eu une douleur dentaire. Nous sommes partis à l'hôpital, mais l'extraction a été très difficile. D'accord? Elle est revenue à la maison avec des morceaux de racines. Quelque temps après, ça s'est infecté. Plusieurs temps en fait, ça s'est infecté, ça s'est transformé en cellulite, une extraction.
Donc, j'ai vu ça comme une chance pour moi de venir suivre la formation afin d'être prêt pour pouvoir aider la population.
Car on dit plus souvent, celui qui ne vit pas pour servir ne sert à rien. Donc c'est ce qui nous motive beaucoup plus.
We have more students that want to come in than we can handle. And that's not due to the personnel here, it's due to the actual physical space for training. So we are expanding the dental school by creating a clinical training center. right? And that's doubling the amount of dental chairs, along with tripling, quadrupling the amount of dental radiology areas, and then we'll be tripling, quadrupling the size of the dental simulation space for students. And those are kind of the areas we've seen over these past 3-4 years that make the biggest impact of improving the clinical skills for students.
Donc, je pense que pour moi, c'est déjà une bénédiction divine que nous ayons eu l'opportunité de développer le département à ce point. Je pense que pour moi, c'est plus qu'une joie, c'est un rêve qui se réalise.
Through this journey and pathway with the dental school, we realized that they were lacking specialists in specific areas in the fields of dentistry.
Nous avons longtemps souffert des difficultés du manque d'enseignants spécialistes.
So currently, Mercy Ships has an agreement with a dental school in Morocco that offers specialization training. That agreement allows us to place Ghanaian dentists, and we specifically chose dental students that spent time with Mercy Ships in their training. And what this agreement states is it gives them access to a 4-year specialty program at the university in Morocco. And once they're completed, the agreement states that they are to return to Guinea and they will become the teachers here at the dental school.
C'est une première, mais en tout cas dans ma carrière, c'est la première fois que je vois ce type de partenariat pour les spécialistes. Et j'espère que ce partenariat ne s'arrêtera pas.
Ça va tout changer. Ça va tout changer parce que là, on n'a pas tellement de spécialistes. On n'en avait pas dans certains domaines, carrément du tout.
You very rarely find a group of people like that are willing to dedicate and work hard and focus and do whatever is necessary to make big changes in themselves, to make big changes for the school, and also have that understanding that everything they're doing is going to make a big change for the Guinea dental system.
On est conscient vraiment de ce qui nous attend demain. Ça, c'est une grande responsabilité.
Je veux travailler dur parce que la seule manière de les remercier, c'est de travailler dur, rentrer au pays et servir.
J'ai hâte de terminer cette formation et rentrer chez moi, partager la formation que nous avons reçue ici. Parce que le besoin est là-bas, on connaît les besoins, on connaît les problèmes, je pense qu'on saura les solutions.
Ce sont des médecins dentistes absolument formidables. Ils ont une volonté d'apprendre, une soif d'apprendre et ils sont vraiment très sérieux. Je pense qu'ils seront les bons profils pour être de bons professeurs dans le futur.
Dr David a inculqué en nous la force, le courage d'apprendre. Il nous a fait rêver.
Il m'a permis de savoir que les études, ce ne sont pas seulement d'être intelligent, mais par contre, c'est d'être endurant et courageux.
Ça a déjà changé notre mentalité de voir notre profession. Ça nous a donné le goût d'avancer. Ça nous a donné le goût d'aller plus loin. Là, il a été à la base d'un tournant qui a vraiment impacté ma vie.
Parce que nous aussi, avec tous les conseils qu'il nous a donnés, on va essayer de se battre. On va se battre pas pour nous seuls. On va se battre pour la Guinée. On va se battre pour faire rayonner la santé bucco-dentaire en Guinée.
C'est pourquoi à chaque fois, chaque jour que je prie pour Mercy Ships et Dr David. Je prie pour eux pour qu'ils puissent davantage avoir les moyens pour aider les gens démunis et voilà, je vais pleurer.
In Mercy Ships, we do anything we can for the patients, no matter what. No matter who they are, no matter where they come from, no matter what religion they are, no matter what tribe they're from, we put our resources for that surgery to be successful and they get the best care possible, which not only includes the surgical care, but also just having nurses and people around them, supporting them, loving them, caring them, treating them well, treating their family well, treating their caregivers well, hugging them, playing with them, singing with them, laughing with them, crying with them. All of those type of things go into why Mercy Ships as an organization is successful with our direct medical services, our direct surgical services. So then if you're looking at how are we going to support medical professionals in Africa, wouldn't you use the same approach? And that's what we're trying to reproduce here. The same stuff that you see when you walk onto the ship. I want someone to walk into Gamal and say, hey, something is different here. I can't understand what it is. That is the number one thing people say about Mercy Ships. I walked onto that ship and something is different here. I cannot explain it, but something is different here. And I hope someone walks into this clinic, into this school and says, hey, something is different here. That will be my measure of success.